Okay, the A to A ratio is the little a to the big A. And that's the PaO2, which comes from blood gas, and the alveolar partial pressure of oxygen, which is the oxygen on the inside of your lung, and they're both measured in torr. So what they show is basically, when you compare these two numbers, how much oxygen that's in the lung is getting across the alveolar membrane. And so what you need to know first is how much is in the lung, the air, the pressure in the lung. So that's from this equation here. So basically you can just kind of look at the equation. The factors are the barometric pressure of the air minus the pressure of the water vapor, okay, 47. FiO2, minus the CO2 pressure, which is here. In this case, we're going to be using 40 and then you multiply that by a factor of 1.25. So you crunch these numbers, and you get, in a normal person breathing room air, 99.73 torr. So that's the pressure, the partial pressure of oxygen in the lung. So how much of that comes across on a normal patient? So like maybe 90% or so. So we know normal blood gas would be between 80 and 90. So suppose it's 90. We put that number over this 99.73, we get 0.9, which is a normal A to A ratio. But how does that work clinically? Okay, so we have a normal patient on 100% non-rebreather. We would calculate out that his lungs have 663 torr of partial pressure oxygen. We'd multiply it by the normal ratio, and we'd get what we think his blood gas would be, right? If we drew it, it would be 597 PaO2, right? So it's very high. Then we can use that clinically. Like, for example, if his blood gas turns out that it's only 200, well, we know that he's not doing good, because he should be, with all that oxygen, it should be 597. And we can actually figure out what his ratio is if we took the 200 and we put it over 666. Oh, maybe it would be 0.3. So that's a low ratio. But the important thing is that you can use a rule of thumb with your FiO2s to calculate your projected PaO2s. So, for example, you just multiply the FiO2 by 5.5, you know what the normal PaO2s would be. So 40% times 5.5, that's like 40 times 5.5 would be 220. So that would be almost 212. So if you just remember this rule of thumb, you'll know what your baseline is, and you can see how your patients are doing. And then if you want to make calculations to see is their A to A ratio improving or declining over time, you can, but you usually don't need to get that involved. You can just kind of use your rule of thumb to see what the baseline is. You can kind of see what the patient was before, and so forth. So that's the A to A ratio. Thanks, bye-bye.